Your heart is always working, minute after minute, day after day. But what happens when it beats too fast or too slow? For older adults, changes in heart rate can be a warning sign. Sometimes it's nothing to worry about. Other times, it could point to something more serious. In this video, we're going to explain how your heart rate works, what's considered normal, and when a slow or fast heartbeat might mean you should see a doctor. Let's start with the basics. Your heart rate is the number of times your heart beats in 1 minute. For most healthy adults, the normal resting heart rate is between 60 and 100 beats per minute. But normal isn't the same for everyone. Some older adults, especially those who exercise regularly or take certain medications, may naturally have a heart rate below 60. And during stress, illness, or activity, your heart rate can go above 100 temporarily. That's expected. What matters is how often these changes happen and whether they come with other symptoms. Now let's look at what happens when your heart beats too slowly. This condition is called bradycardia. It means your heart rate is consistently below 60 beats per minute. For some people, this is totally normal. But for others, bradycardia can be dangerous. If your heart is not pumping enough blood to the brain and body, you may feel dizzy, tired, or even faint. Some people notice shortness of breath, trouble concentrating, or confusion. Bradycardia can be caused by age-related changes in the heart, certain medications, or conditions like hypothyroidism and sleep apnea. It can also be a sign of damage to the heart's electrical system. On the other side is tachycardia. This is when your heart is beating too fast, usually over 100 beats per minute when you're at rest. There are many types of tachycardia, some more serious than others. A common one in older adults is atrial fibrillation, or AFib. This is when the heart's upper chambers beat irregularly and out of sync with the lower chambers. You may feel palpitations, fluttering in the chest, or fatigue. Sometimes people with AFib feel nothing at all. But AFib increases the risk of stroke and heart failure, which makes early detection very important. Both bradycardia and tachycardia can be dangerous if left untreated. That's why it's important to pay attention to symptoms. Fatigue, lightheadedness, fainting, chest pain, or shortness of breath are red flags. Don't assume it's just part of getting older. If something feels off, get it checked. Some seniors also experience heart rhythm problems due to medications they're taking. Beta blockers, calcium channel blockers, and digoxin can all slow the heart. Dehydration, infections, or imbalances in potassium and magnesium levels can also affect heart rhythm. So, how do you know what's normal for you? One good step is to track your heart rate. You can do this by feeling your pulse at your wrist or neck and counting the beats for 30 seconds, then multiplying by 2. Some smart watches and fitness bands can also track your heart rate throughout the day and night. If you notice your resting heart rate is consistently too high or too low, or if it suddenly changes, tell your doctor. Diagnosing heart rhythm problems usually starts with an electrocardiogram, also called an EKG or ECG. It's a painless test that records the electrical signals in your heart. If the results are unclear, your doctor may ask you to wear a portable monitor, like a Holter monitor, for 24 to 48 hours. These devices track your heart rhythm during your normal activities. In some cases, longer-term monitors or event recorders are used to catch irregular rhythms that don't happen every day. Once the problem is diagnosed, The treatment depends on the cause. For bradycardia that causes symptoms, a pacemaker may be recommended. This is a small device implanted under your skin that sends electrical pulses to help your heart beat regularly. It's usually placed near the collarbone and connected to your heart by thin wires. Most people go home the same day or the next and can return to normal activities within a week or two. For tachycardia, especially atrial fibrillation, treatment might include medication to control the heart rate or rhythm. Blood thinners are also often prescribed to reduce stroke risk. In some cases, procedures like cardioversion or ablation are used to restore normal rhythm. Cardioversion delivers a controlled electric shock to the heart. Ablation uses heat or cold energy to destroy small areas of tissue that are causing the irregular rhythm. These are usually outpatient procedures. Lifestyle changes can also help. Reducing caffeine and alcohol, quitting smoking, managing stress, and staying physically active can all support a healthy heart rhythm. Eating a heart-friendly diet that's low in salt, high in fiber, and full of fruits and vegetables is key. Also, make sure to stay hydrated. Even mild dehydration can affect heart rate. If you're on medications that affect your heart rate, always take them exactly as prescribed. Never stop a heart medication suddenly without talking to your doctor. Bring a list of all the medications you take to every appointment, including over-the-counter drugs and supplements. Sometimes the interaction between medications is the problem, not the heart itself. It's also worth noting that heart rate can change as part of other health problems. Fever, infections, anemia, or thyroid issues can all cause your heart to beat faster or slower. That's why a full medical evaluation is important when you notice a change. Now, let's talk about something many people don't realize. Anxiety and panic attacks can also raise your heart rate. The feeling of a racing heart can be scary, especially if you don't know where it's coming from. But in these cases, your heart is structurally fine. Stress management, breathing exercises, and sometimes therapy or medication can help. So, what's the bottom line? A heart that's beating too fast or too slow may not mean there's something seriously wrong, but it's never something to ignore. Know you're normal. Watch for patterns. And don't be afraid to speak up if something doesn't feel right. You know your body better than anyone. And early action can prevent serious problems later on. If you're not sure whether a symptom is urgent, here's a quick guide. Go to the emergency room if you feel faint, experience chest pain, have difficulty breathing, or your heart rate jumps or drops suddenly for no clear reason. Call your doctor if you notice your heart skipping beats, feel tired all the time, or see changes in your heart rate while resting. Regular checkups are also key. During your appointments, ask your doctor to check your pulse and review your medications. If you've had rhythm problems before, you may need regular EKGs or even a referral to a cardiologist. Don't skip appointments even if you feel fine. Some heart problems are silent at first. In summary, your heartbeat is more than just a number. It's a signal about how your body is doing. Whether it's fast, slow, or irregular, every beat matters. Stay informed, stay proactive, and talk to your doctor about what's best for you.